Hi everybody. So in this video, I'm going to talk about stability of the hips from side to side. We're going to look at how those muscles work and fire to keep yourself stacked well, to keep your shoulders over your pelvis and your hips, over your knees and over your feet. So healthy hips, healthy knees require that for different reasons. Okay, so your knees basically are dependent on good control of the hip muscles for them to feel good and be healthy. So if you don't have control of your hips, a lot of times the knee or even the back takes the brunt of the force from that. Okay, so here's a quick simple test. I recommend having something to use for balance, okay, just so it's not completely about the balance. So we're going to stand on one leg and see how well you're able to control your hips, your hip muscles in the side to side plane. So I'm going to use this for a little bit of balance. I'm going to stand on this leg, which is my right leg. So before I even do that, I just bend my left knee. So I'm just on my tiptoes on the left side. And I already am thinking about squeezing those outer hip muscles to draw the hip in so I stay stacked. Hip over the knee over the foot, and then I pick up my leg and I hold it, okay? So you'll see how easy or how hard that may be for you, and then you'll bring the leg down, switch your support. Actually, I take it back. You can have the support on either side, whatever feels more comfortable for you, okay? This is just the way I did it today. So I'm gonna stand on my left leg. So I bend my right knee, balancing on my tiptoes, using my hand for balance, already thinking about drawing these outer left hip muscles in, and then I pick my leg up and then hold it there, okay? So I'm working on the stability of these outer hip muscles to keep me from letting that hip pop way out to the side. So when you do this, do it in front of a mirror, because you might notice when you pick up one leg that this might happen. Maybe you'll see, whoa, okay, that's telling you these hip muscles are not doing a great job of pulling that hip into the socket and keeping you stable. So then the way you would do this as an exercise is draw in, balance, hold that in, lift the knee, and then hold it for a count of 10, 20. You can work your way up. If you get really good at it, let go and balance there, but the whole time drawing that outer hip into the socket. All right, so that's stability of the pelvis and the hips in the side to side plane. From the muscle standpoint, it's a lot of gluteus medius, the glutes that are on the outside of the hips, that help you stabilize there. A little bit of glute max too, but mostly glute medius.